When Diane Robertson gave birth to triplets in 2006, her baby spent nearly 3 months in the neonatal ICU at Community Regional, where they received round-the-clock, compassionate, family-centered care. Today, Diane works with IT for Community Health System and says she and her family want to come back to Terry's house to provide hope and support for families with loved ones at Community Regional. When Diane Robertson was pregnant with triplets, she was sent to Community Regional Medical Center for a non-stress test to check on the health of her babies.
They wanted to monitor the baby's heartbeats, and they asked me to spend the night on June 13th. And the morning of June 14th, the doctor came in and told me there were some irregular heartbeats.
Her babies were born months early and spent time at Community Regional's Level 3 neonatal ICU.
I was at Community every day. I would drive from my home to the hospital for 3 months, sitting by my baby's isolettes for 8 hours a day. And whenever I would have to go home, I knew they were in the best care.
Experiencing firsthand the level of care team members at Community provide to patients every day, Diane wanted to give back to the hospital and join the health system in 2008.
I think a lot of it has to do with the nurses and the physicians and how compassionate and caring they are. I've experienced that myself. They just take the time to answer all your questions, and they take care of all the fears you have.
And Diane understands the anxiety some new moms may experience when their children are in the hospital.
I have been in the places of feeling uncertain, scared of what was going to happen to my babies. And when I found out that Terry's house was being built, I wanted to give back.
Terry's house has been a home away from home for many families of patients in the NICU and other critical care areas of Community Regional. And being a short walk away from their baby has made all the difference.
The families in the next generation, we want to continue to have that growth, and that's why this volunteer program is so crucial, to be able to continue to feed our families, to have these donation drop-offs so that we can provide a safe, calm place where the families can be able to recharge, sleep, get their laundry done, take a shower, but really impactful of the meals that they're serving.
Diane and her now grown babies have recently brought in food and supplies to help Terry's house.
So behind me is my daughter Madison Robertson, Michelle Robertson in the middle, and Ryan Robertson on the end. I'm so blessed that my children are thriving as they are today. They're healthy, they're excited about their futures.
Whitney says volunteers like Diane and her family really make a difference in the lives of the families that stay at Terry's house.
As much as they have to be their eyes and ears and advocates for their patient, they're able to see what's going on in making those tough medical decisions, and they can't do them soundly if they don't have sleep and if they haven't eaten. So we also have the resources available with our social worker and case management. It's an integral part to work with the medical care team across the street. So we're able to be a one-stop shop of a home, but we really walk them through the whole journey from the start.